7.1 Gastrointestinal Introduction. Learning objectives. Identify the classifications and actions of gastrointestinal system drugs. Give examples of when, how, and to whom gastrointestinal system drugs may be administered. Identify the side effects and special considerations associated with gastrointestinal system drug therapy. Identify considerations and implications of using gastrointestinal system medications across the lifespan. Apply evidence-based concepts when using the nursing process. Identify indications and adverse side effects associated with the use of herbal supplements. Identify and interpret related laboratory tests. Identify nursing responsibilities related to health teaching and health promotion. Gastrointestinal disorders are common. How many times have you heard someone complaining of an upset stomach, heartburn, nausea, constipation, or diarrhea? Occasionally, these ailments will go away on their own, but if they do not, there are a variety of medications that can be used to treat them. Treatment can include prescription and over-the-counter drug therapy in addition to non-pharmacological interventions. In this chapter, you will learn about medications used to treat common disorders within the gastrointestinal system. 7.2 Basics Concepts of the gastrointestinal system. Prior to discussing specific GI disorders and associated medication classes, it is important to have a clear understanding of the anatomy, the gastrointestinal system. Review of anatomy of the gastrointestinal system. It is important to know the basic anatomy and physiology of the gastrointestinal system to understand how gastrointestinal medications 1 work. See Figure 7.1 for an illustration of the anatomical components of the GI system. There are a variety of medications used to treat common GI disorders, so this chapter's content is divided into 3 subsections discussing medications classes treating common disorders: anti-ulcer, antidiarrheals, laxatives, and antiemetics. Each subsection will further review the GI anatomy and physiology related to these conditions and medications. Figure 7.1 Components of GI System. For additional details related to the content in this chapter, review information in OpenStack's Anatomy and Physiology using the areas noted below. Overview of the digestive system. Digestive system processes and regulation. The stomach, when taught in small and large intestines. Chemical digestion and absorption, a closer look. See the following supplementary YouTube videos to review the gastrointestinal system and digestive processes. Gastrointestinal System Review. 1 or more interactive elements has been excluded from this version of the text. You can view them online here. TED Ed Review of Digestive System. Khan Academy Review of GI System 5. 7.3 Anti-ulcer Medications. This section will review the anatomy and pathophysiology of the digestive process and common hyperacidity disorders, and then apply the nursing process to administering several hyperacidity medications. Review of anatomy and pathophysiology of the digestive process. This section will discuss anti-ulcer medications. We will begin by reviewing the anatomy and physiology of the digestive process. The stomach contains cells that secrete different substances as part of the digestive process: parietal cells, chief cells, and surface epithelium cells. See an image of the stomach and these cells in Figure 7.2. Figure 7.2. An image of the stomach, with surface epithelium cells in the mucosa, and an enlarged image of the gastric gland, showing chief and parietal cells. Surface epithelium cells are found within the lining of the stomach and secrete mucus as a protective coating. Parietal cells and chief cells are found within the gastric glands. Parietal cells produce and secrete hydrochloric acid to maintain the acidity of the environment of a pH of 1 to 4. Parietal cells also secrete a substance called intrinsic factor, which is necessary for the absorption of vitamin B12 in the small intestine. Parietal cells are the primary site of action for many drugs that treat acid-related disorders. Chief cells secrete pepsinogen that becomes pepsin, a digestive enzyme, when exposed to acid. The stomach also contains enteroendocrine cells located in the gastric glands that secrete substances, including serotonin, histamine, and somatostatin. G cells in the stomach secrete gastrin that promotes secretions of digestive substances. Although these cells play an important role in the digestive system, acid-related diseases can occur when there is an imbalance of secretions. The most common mild to moderate hyperacidic condition is gastroesophageal reflux disease, often referred to by clients as heartburn, indigestion, or sour stomach. GERD is caused by excessive hydrochloric acid that tends to back up or reflux into the lower esophagus. See Figure 7.3 for an illustration 2 of GERD. Figure 7.3 Illustration of GERD. Hyperacidity disorders. Peptic ulcer disease occurs when gastric or duodenal ulcers are caused by the breakdown of GI mucosa by pepsin in combination with the caustic effects of hydrochloric acid. PUD is the most harmful disease related to hyperacidity because it can result in bleeding ulcers, a life-threatening condition. Stress-related mucosal damage is another common condition that can occur in hospitalized clients leading to PUD. Thus, many postoperative or critically ill clients receive medication to prevent the formation of stress 3-4 ulcers. See an image of a duodenal ulcer in Figure 7.4. Figure 7.4 Image of a duodenal ulcer. View supplementary videos on heartburn and gastric ulcers. Heartburn, gastric ulcer. Applying the nursing process to hyperacidity medications. Assessment. Whenever a nurse administers hyperacidity medications, there are common assessments that should be documented, such as an abdominal assessment and documentation of bowel patterns. During therapy, the nurse should continue to assess for potential medication interactions and side effects, and be aware that vitamin B12 malabsorption may occur whenever stomach acidity levels are altered. Based on the category of medication, renal and liver function may require monitoring. Additionally, if a client complains of chest pain, the nurse should perform a complete focused cardiac assessment and not assume it is GI-related, because clients may erroneously attribute many cardiac conditions to heartburn. Implementation. The nurse should read the drug label information and follow the recommendations for administering hyperacidity medications with other medications or the intake of food. Cultural preferences should also be accommodated when safe and feasible, because the client may believe in alternative methods for treating GI discomfort. A written plan of care with modifications for safe use of medications with these alternative methods may be required. Evaluation. Clients should experience improvement of symptoms within the defined time period. If not, the provider should be notified. Increased pain or new symptoms of coughing, vomiting of blood should be immediately reported, because these symptoms can be signs of a life-threatening bleeding ulcer. Hyperacidity medication classes. There are 4 major classes of medications used to treat hyperacidity conditions: antacids, H2 receptor antagonists, proton pump inhibitors, and mucosal protectants. Each class of medication is further described below. Antacids. Antacids are used to neutralize stomach acid and reduce the 7 symptoms of heartburn. There are many OTC medications available for this purpose, such as calcium carbonate, aluminum hydroxide, and magnesium hydroxide. Calcium carbonate is the prototype discussed as an example. Be sure to read drug label information regarding antacids as you administer them, because each type has its own specific side effects. Many antacids also contain simethicone, an antiflatulent used for gas relief. Simethicone is further described in the medication grid below. Figure 7.5 Antacids. Mechanism of action. Antacids neutralize gastric acidity and elevate the pH of the stomach. Elevated pH also inactivates pepsin, a digestive enzyme. Indications. Antacids are used to relieve heartburn, acid indigestion, and upset stomach. Nursing considerations. Calcium carbonate comes in various formations, such as a tablet, a chewable tablet, a capsule, or liquid to take by mouth. It is usually taken 3 or 4 times a day. Chewable tablets should be chewed thoroughly before being swallowed. Do not swallow them whole. The client should drink a full glass of water after taking either the regular or chewable tablets or capsules. Some liquid forms of calcium carbonate must be shaken well before use. Do not administer calcium carbonate within 1 to 2 hours of other medicines because calcium may decrease the effectiveness of the other medicines. Calcium carbonate may be contraindicated in clients with pre-existing kidney disease because it may cause hypercalcemia. Side effects, adverse effects. Common side effects of calcium carbonate include constipation and rebound hyperacidity when it is discontinued. Health teaching and health promotion. In addition to the information under nursing considerations, clients should be reminded to take OTC meds appropriately as prescribed and to not exceed the maximum dose. Other interventions to prevent hyperacidity can also be recommended, such as smoking cessation and avoiding food and beverages that can cause 1, 10, 11, 12% increased acidity. H2 receptor antagonist. A common H2 receptor antagonist is famotidine. It is available OTC and is also often prescribed orally or as an IV injection in the hospital setting. Other. 8. ADAM Medical Encyclopedia. Atlanta, ADAM, Inc., Heartburn, Anatomy Videos 000068.htm. 9. Lilly L., Collins S., and Snyder J. Pharmacology in the Nursing Process. pp. 782 to 862. Elsevier. 10. MC Question L. Vuljoin D. Maggio K. Winton M. and Yeager J. Pharmacology, a patient-centered nursing process approach. pp. 443 to 454. Elsevier. 11. This work is a derivative of Daily Med by U.S. National Library of Medicine in the public domain. 12. ADAM Medical Encyclopedia. Atlanta, ADAM Inc., Heartburn. H2 receptor antagonists include cimetidine and ranitidine. Cimetidine has a high risk of drug interactions, especially in elderly clients because of its binding to cytochrome P450 enzymes in the liver, which affects the metabolism of other drugs. Mechanism of action. H2 receptor antagonists block histamine's action at the H2 receptor of the parietal cell, thus reducing the production of hydrochloric acid. 13 indications. Famotidine is used to treat GERD, peptic ulcer disease, erosive esophagitis, and hypersecretory conditions, or as adjunct treatment for the control of upper GI bleeding. OTC famotidine is also used to treat heartburn or sour stomach. Nursing considerations. To prevent symptoms, oral famotidine is taken 15 to 60 minutes before eating foods or drinking drinks that may cause heartburn. Pre-existing liver and kidney disease may require dosage adjustment. Famotidine is supported by evidence as safe for use in pediatric clients younger than 1 year old, as well as in elderly clients. Side effects, adverse effects. Common side effects include headache, dizziness, constipation, and diarrhea. Individuals must immediately report increased pain or other signs of bleeding ulcers, such as coughing, vomiting of blood. Health teaching and health promotion. Clients taking the oral suspension should be instructed to shake it vigorously for 5 to 10 seconds prior to each 1,415 use. The medication may cause constipation, so fluids and high-fiber diet should be encouraged. Additionally, smoking interferes with histamine 17 antagonists and should be discouraged. Figure 7.6 OTC famotidine. Proton pump inhibitors. A common proton pump inhibitor is pantoprazole. It may be prescribed in various routes, including orally, with an NG tube, or as an IV injection in the hospital setting. Other PPIs include esomeprazole, lansoprazole, and omeprazole. PPIs are more powerful than antacids and H2 receptor antagonists. Figure 7.7 OTC omeprazole. Mechanism of action. PPIs bind to the hydrogen-potassium ATPase enzyme system of the parietal cell, also referred to as the proton pump, because it pumps hydrogen ions into the stomach. PPIs inhibit the secretion of hydrochloric acid, and the anti-secretory effect lasts longer than 24 hours. Indications: pantoprazole is used to treat damage from gastroesophageal reflux disease in adults and children 5 years of age and older by allowing the esophagus to heal and prevent further damage. It is also used to treat conditions where the stomach produces too much acid, such as Zollinger-Ellison syndrome in adults. PPIs may also be given in combination with antibiotics to treat H. pylori infections, a common cause of duodenal ulcers. Nursing considerations: packets of delayed-release granules must be mixed with applesauce or apple juice and taken by mouth or given through a feeding tube. Consult the labeling of concomitantly used drugs to obtain further information about interactions, because PPIs can interfere with the liver metabolism of other drugs. 4. Pantoprazole can potentially exacerbate zinc deficiency, and long-term therapy can cause hypomagnesemia, so the nurse should monitor for these deficiencies. Side effects. Adverse effects. Concerning side effects of proton pump inhibitors include hypersensitivity, anaphylaxis, and serious skin reactions. Individuals taking proton pump inhibitors may also be susceptible to zinc, magnesium, and B12 deficiencies. Clients may also experience headache, abdominal pain, diarrhea, or constipation. Individuals taking proton pump inhibitors may also be at risk for acute renal dysfunction, osteoporosis, and acute lupus erythematosus. If individuals experience increased pain or signs of a bleeding ulcer, such as coughing, vomiting blood, this should be immediately reported to their healthcare provider. Long-term use of PPIs may also increase the risk of pneumonia. Health teaching and health promotion. In addition to the considerations above, instruct clients to call their provider if their condition does not improve 21 or gets worse, especially if bleeding occurs. Use of alcohol, NSAIDs, or foods 23 that cause GI irritation should be discouraged. Mucosal protectants. Sucralfate is a mucosal protectant used to cover and protect gastrointestinal ulcers. Mechanism of action: sucralfate locally covers the ulcer site in the GI tract and protects it against further attack by acid, pepsin, and bile salts. It is minimally absorbed by the gastrointestinal tract. Indications: sucralfate is used in the treatment of ulcers. Nursing considerations: administer sucralfate on an empty stomach 2 hours after or 1 hour before meals. Sucralfate should be cautiously used with clients with chronic renal failure or those receiving dialysis due to 19. Drayson J.A., Hansen B.E., Van der Waal E., De Boer A., Janssen H.L., and Denecht R.J. Proton pump inhibitor use and the risk of pneumonia, a systematic review and meta-analysis of observational studies. Expert review of clinical pharmacology, 12, 935 to 947. 20. Lilly L., Collins S., and Snyder J. Pharmacology and the Nursing Process. pp. 782 to 862. Elsevier, 21. MC Quishin L., Wiljoin DiMaggio K., Winton M., and Yeager J. Pharmacology, a patient-centered nursing process approach. pp. 443 to 454. Elsevier, 22. This work is a derivative of Daily Med by U.S. National Library of Medicine in the public domain. 23. ADAM, Medical Encyclopedia. Atlanta, ADAM Inc., 2019. Heartburn, reviewed May 10, 2019, impaired occur with sucralfate. Side effects, adverse effects. A common side effect related to mucosal protectant medications includes constipation. Health teaching and health promotion. In addition to the considerations above, instruct clients to call their provider if their condition does not improve. 24,252,627, or gets worse. Antiflatulent. Simethicone is an antiflatulent that is commonly found in other OTC antacids. 28. It is also safe for use in infants. Gas commonly occurs in the GI tract due to digestive processes and the swallowing of air. gaseous distension can also occur postoperatively. Figure 7.8 combination OTC product with simethiquone. 26. This work is a derivative of Daily Med by U.S. National Library of Medicine in the public domain. 27. ADAM Medical Encyclopedia, Atlanta, ADAM Inc., 2019. Heartburn, mechanism of action. Simethiquone works by altering the elasticity of the mucus-coated gas bubbles, which cause them to break into smaller bubbles, thus reducing pain and facilitating expulsion. Indications: simethiquone is used to treat the symptoms of gas such as uncomfortable or painful pressure, fullness, and bloating. Nursing considerations: simethiquone is usually taken 4 times a day, after meals and at bedtime. For liquid form, shake drops before administering. Side effects: adverse effects. Common side effects include nausea, constipation, diarrhea, or headache. Health teaching and health promotion. Clients can be instructed about other measures to assist with gas expulsion, such as changing position, ambulating, avoiding the use of straws, and tapering intake of beans and cruciferous vegetables. 30, 31, 32. An interactive H5P element has been excluded from this version of the text. You can view it online here. 31. This work is a derivative of Daily Med by U.S. National Library of Medicine in the public domain. Now let's take a closer look at the medication grids comparing medications. 33, 34, 35. 36 used to treat hyperacidity in Table 7.3. Medication grids are intended to assist students to learn key points about each medication. Because information about medication is constantly changing, nurses should always consult evidence-based resources to review current recommendations before administering specific medication. Basic information related to each class of medication is outlined below. Detailed information on a specific medication can be found for free at Daily Med. On the home page, enter the drug name in the search bar to read more about the medication. Prototype generic medications listed in the grids below are also linked to a Daily Med page. Table 7.3 Hyperacidity Medication Grids. 35. This work is a derivative of Daily Med by U.S. National Library of Medicine in the public domain. Critical Thinking Activity 7.3. A client who recently underwent surgery has a medication order for daily pantoprazole. The nurse reviews the client's medical history and finds no history of GERD or peptic ulcer disease. The client does not report any symptoms of heartburn, stomach pain, or sour stomach. The nurse reviews the provider orders for an indication for this medication before calling the provider to clarify. What is the likely indication for this drug therapy for this client? Note: answers to the critical thinking activities can be found in the answer keys section at the end of the book. 7.4 Anti-diarrheal medications and laxatives. This section will review the anatomy and pathophysiology of defecation and the condition of diarrhea, and then apply the nursing process to administering antidiarrheals. From there, we will discuss the condition of constipation, apply the nursing process to treating constipation, and discuss classes of laxatives. Review of anatomy and physiology of defecation. The digestive system is continually at work, but unless something goes amiss, you don't notice your digestive system working. This section will focus on bowel disorders that occur in the lower intestine during the final step of digestion called defecation, when undigested materials are removed from the body as feces. During this final step, the large intestine absorbs water and changes the waste from liquid into stool, then peristalsis helps move the stool into the rectum. Diarrhea and constipation occur when conditions occur that affect this final step of defecation. The process of defecation begins when mass movements force feces from the colon into the rectum, stretching the rectal wall and provoking the defecation reflex, which eliminates feces from the rectum. This parasympathetic reflex is mediated by the spinal cord. It contracts the sigmoid colon and rectum, relaxes the internal anal sphincter, and initially contracts the external anal sphincter. Figure 7.9 reviews the anatomy of the rectum and its external and internal sphincters. The presence of feces in the anal canal sends a signal to the brain, which gives the person the choice of voluntarily opening the external anal sphincter or keeping it temporarily closed. If defecation is delayed until a more convenient time, it takes a few seconds for the reflex contractions to stop and the rectal walls to relax. The next mass movement will trigger additional defecation reflexes too until defecation occurs. Figure 7.9 Anatomy of the rectum. If defecation is delayed for an extended time, additional water is absorbed, making the feces firmer and potentially leading to constipation. Alternatively, if the waste matter moves too quickly through the intestines, not enough water is absorbed, and diarrhea can result. Figure 7.10 demonstrates the Bristol stool chart that is used to assess stool characteristics, ranging from very constipated to diarrhea. Bristol stool chart. Figure 7.10 Bristol stool chart. Additional information about how the digestive system works can be reviewed using the information below. On digestive system processes and regulation in OpenStax Anatomy and Physiology. Learn your digestive system and how it works. Diarrhea. Diarrhea is defined as the passage of 3 or more loose or liquid stools per day. Frequent passing of formed stools is not considered diarrhea. Diarrhea has multiple causes such as bacteria from contaminated food or water, viruses such as influenza, norovirus, or rotavirus, parasites found in contaminated food or water, medicines such as antibiotics, cancer drugs, and antacids that contain magnesium, food intolerances and sensitivities, and diseases that affect the colon, such as Crohn's disease or irritable bowel syndrome. The most severe threat posed by diarrhea is dehydration caused by the loss of water and electrolytes. Diarrheal disease is a leading cause of child mortality and morbidity throughout the world due to dehydration. Frail elderly are also at risk. When severe diarrhea occurs, assessment for dehydration and electrolyte imbalances receive top priority, and rehydration with oral rehydration common medications used to solutions or IV fluids may be required. Manage the symptoms of diarrhea are discussed below. Applying the nursing process to administering anti-diarrheals. Assessment. When administering anti-diarrheals, the nurse should document an abdominal assessment, frequency of bowel movements and stool, characteristics, and if there is skin breakdown in the anal area. Dehydration is a serious risk in clients with severe diarrhea, so priority assessments and documentation relate to monitoring for dehydration, especially in vulnerable populations of infants, children, and elderly. If signs of dehydration occur, the provider should be immediately notified and treatment initiated for dehydration. Implementation. Teach the client to not exceed dosages of OTC medications because life-threatening adverse effects may occur. Probiotics have been found to be likely safe in all populations, and the nurse can advocate for the use of probiotics in clients with diarrhea or those at risk for diarrhea because of other medications prescribed. In addition to teaching about medication therapy, nurses can also teach clients with diarrhea other non-pharmacological interventions, such as replacing fluid and electrolytes by drinking water, sports drinks, or sodas without caffeine, and eating soft, bland food like bananas, rice, and toast. Children with severe diarrhea may also require oral rehydration solutions to replace lost fluids and electrolytes. The nurse should also keep in mind that antidiarrheals should be used very cautiously with children because some categories are contraindicated. Evaluation. Because antidiarrheals treat the symptoms of diarrhea but do not eliminate the cause of it, if symptoms do not resolve within 48 hours, the provider should be notified and other potential causes of diarrhea investigated. Monitor for serious adverse effects, such as increased bleeding in clients taking salicylates and for abnormal heart rhythms in clients taking loperamide, and notify the provider immediately. Evaluation for dehydration should continuously occur until the condition resolves. Antidiarrheal medication classes. There are three common mechanisms of action of antidiarrheal medications: adsorbents, which help eliminate the toxin or bacteria from the GI tract, antimotility agents, which slow peristalsis, and probiotics, which help to restore the normal bacteria found in the lower intestine. Oral rehydration agents may also be used in clients with diarrhea to replace fluid and electrolyte loss, but they do not treat the diarrhea. Antibacterial agents may also be used to treat diarrhea caused by specific infections, such as Campylobacter or Giardia, but they are not routinely needed. Adsorbents. Adsorption is the adhesion of molecules to a surface. This process differs from absorption, where a substance is dissolved or penetrates into a surface. Bismuth subsalicylate is an example of a 9-adsorbent, figure 7.1. 1. Bismuth subsalicylate. Mechanism of action: adsorbent medications work by coating the walls of the GI tract and binding the causative bacteria or toxin for elimination from the GI tract through the stool. Bismuth subsalicylate also decreases the flow of fluids and electrolytes into the bowel, reducing inflammation within the 11th intestine. Indications: adsorbent medications are used to treat conditions that involve excess gas or toxins in the digestive system. Nursing considerations: bismuth subsalicylate contains salicylate. It should be avoided if the client has an allergy to salicylates or if the client is taking other salicylate products such as aspirin. It should not be used if the client has an ulcer, a bleeding problem, or bloody or black stool. Children and teenagers who have or are recovering from chickenpox or flu-like symptoms should not use this product. When using this product, if changes in behavior with nausea and vomiting occur, consult a provider because these symptoms could be an early sign of Reye's syndrome, a rare but serious illness. Liquid products should be shaken well before use. Tablets should be swallowed whole and not chewed unless they are a chewable tablet. Medication can cause a black or darkened tongue. If symptoms worsen, a fever or ringing in the ears occurs, or if diarrhea lasts longer than 481,213 hours, contact the provider. Side effects, adverse effects. Side effects of adsorbent medications include black or darkened tongue. Individuals should contact their provider if symptoms worsen or if they experience a fever or ringing in the ears. Health teaching and health promotion. Clients should be advised to take medication as directed. They should be aware of potential color changes to stool that may occur and that the medication contains aspirin. They should discontinue the medication if tinnitus occurs. Antimotility. Antimotility medications help to treat diarrhea by slowing peristalsis. There are two categories of antimotility medication: anticholinergics and opiate-like medications. Anticholinergics. Mechanism of action: hyoscyamine is an anticholinergic that works on the smooth muscle of the GI tract to inhibit propulsive motility and decreases gastric acid secretion. Indications: anticholinergic medications are a class of drugs that block the action of the neurotransmitter acetylcholine in the nervous system. Nursing considerations: read drug label information for all. Contraindications, including but not limited to glaucoma, myasthenia gravis, and paralytic ileus. Diarrhea may be an early symptom of incomplete intestinal obstruction, and the use of this drug would be inappropriate and possibly harmful. CNS symptoms and other adverse effects may occur that are common with anticholinergic medications. Side effects, adverse effects. Common side effects of anticholinergic medications include dry mouth, constipation, blurred vision, and confusion, especially in older adults. Health teaching and health promotion. Clients should receive instruction that these medications may cause dizziness and drowsiness. If client 17 experience dry mouth, frequent oral hygiene may alleviate discomfort. Opioid-like medication. Mechanism of action: loperamide has an opioid-like chemical structure, but causes fewer CNS effects. It works by decreasing the flow of fluids and electrolytes into the bowel, and by slowing down the movement of the bowel to decrease the number of bowel movements. Figure 7.12 Loperamide. Indications: opioid-like medications such as loperamide work by slowing down the movement of the intestines, which reduces the frequency and volume of bowel movements. Nursing considerations: loperamide should not be given to a child younger than 2 years of age because of the risk of serious breathing and heart problems. Taking more than the prescribed dose can cause a serious abnormal heart rhythm that can lead to death. Read the drug label carefully for information about interaction with other medications, especially 20 antidysrhythmics and antipsychotics. Side effects, adverse effects. Common side effects of loperamide may include constipation, abdominal discomfort, nausea, vomiting, dizziness, drowsiness, or allergic skin reactions such as hives. Health teaching and health promotion. Clients should take medications as directed. They should also avoid alcohol and other CNS depressants. The 21 medications may cause drowsiness. Probiotics. Probiotics are used for the prevention and treatment of diarrhea. They are often used concomitantly with antibiotics to prevent the common associated 22 side effects of diarrhea. An example of a probiotic is lactobacillus. Figure 7.13 Probiotics come in several forms. Mechanism of action: probiotics help replenish normal bacterial flora in the gastrointestinal tract. Indications: probiotics are live microorganisms that are beneficial for digestive health. Nursing considerations: probiotic usage should be tailored to the individual's specific health needs because not all strains of probiotics have the same health benefits. Side effects, adverse effects. Probiotics may have some side effects such as gas, bloating, and diarrhea. Health teaching and health promotion. Side effects of probiotics are mild 24 such as gas and bloating. Probiotics are safe for use in children. Now let's take a closer look at medication grids comparing medications 25-26 used to treat diarrhea. Medication grids are intended to assist students to learn key points about each medication. Because information about medication is constantly changing, nurses should always consult evidence-based resources to review current recommendations before administering specific medication. Basic information related to each class of medication is outlined below. Detailed information on a specific medication can be found for free at DailyMed. On the home page, enter the drug name in the search bar to read more about the medication. Prototype, generic medications listed in the grids below are also linked directly to a DailyMed page. Table 7.4a Diarrhea Medication Grids. 1. A client has been prescribed loperamide for diarrhea associated with gastroenteritis. The client begins to complain of heart palpitations. What is the nurse's next best response? 2. A child aged 6 has diarrhea. The mother asks the nurse what OTC medications she can provide to her child to help resolve the diarrhea. What is the nurse's best response? Note: answers to the critical thinking activities can be found in the answer key section at the end of the book. Constipation. Constipation is defined as 3 or fewer bowel movements in a week. Stools that are hard, dry, or lumpy, stools that are difficult or painful to pass, or the 27 feeling that not all stool has passed. If defecation is delayed for an extended time, additional water is absorbed, thus making the feces firmer and potentially leading to constipation. There are several causes of constipation, such as lack of proper fluids or fiber in the diet, lack of ambulation, various disease processes, recovery from surgical anesthesia and opiates, and side effects of many medications. A list of these potential causes can be found in Table 7.4 billions. Because there are several potential causes of constipation, treatment should always be individualized to the client. Many times, constipation can be treated with simple changes in diet, exercise, or routine. However, when medications are also needed to resolve constipation, there are several categories of laxative medications that work in different ways. Classes of laxative medications are described below. Table 7.4 billions common causes of constipation. 28. National Institute of Diabetes and Digestive and Kidney Diseases, National Institutes of Health. Symptoms and causes of constipation. Assessment. The nurse should assess for the potential cause of the client's constipation and appropriately individualize the treatment and health teaching. The nurse should document an abdominal assessment that includes discomfort, distension, and decreased bowel sounds. The date of the last bowel movement should also be documented. The client may be asked additional history questions, such as the appearance of the stool to determine if it is hard and dry, if passing the stool is difficult or painful, or if there is a feeling of incomplete emptying. Implementation. Many facilities have a bowel medication protocol with progressive treatment of constipation, ranging from stool softeners to stimulants to enemas, depending on the length of time since the last bowel movement. Medications should be administered according to label instructions, and the client should be instructed when to expect a bowel movement will occur. Measures to prevent constipation should also be discussed with the client. Patient teaching for all classes of laxative medications should be individualized based on the cause of constipation. These measures to prevent constipation should be reviewed with the client. Getting enough fiber in the diet, drinking plenty of water and other liquids, getting regular physical activity, trying to have a bowel movement at the same time every day. Evaluation. If a bowel movement does not occur within the expected time frame, the provider should be notified and other causes investigated for individualized treatment. It is imperative that good documentation of bowel movements and communication among staff occur when constipation is being treated with various medications. If there is a complete absence of bowel sounds, worsening distension or abdominal pain, a smearing of stool, or other findings indicating that a paralytic ileus or blockage may be occurring, the provider should be immediately notified. Laxative medication classes. There are 5 categories of laxative medications commonly used to treat constipation: fiber supplements, stool softeners, osmotic agents, lubricants, and stimulants. Fiber supplements and stool softeners are often used daily to prevent constipation, whereas the other laxative categories are used to treat constipation. Table 7, 4C compares the mechanism of action for each laxative 3132 category and includes common prototype and OTC brand names. Table 7.4. See categories of laxatives used to treat constipation. Fiber supplements. Psyllium is an example of a common OTC fiber 33 supplement. Figure 7.1. 4 psyllium in powder form. Mechanism of action: psyllium adds bulk to the stool to facilitate passage through the rectum. Indications: a type of soluble fiber that is commonly used as a dietary supplement and as an ingredient in some medications to help treat constipation. Nursing considerations: when administering, put 1 dose into an empty glass and mix with at least 8 ounces of water or other fluid. Taking this product without enough liquid may cause choking. Stir briskly and drink promptly. If mixture thickens, add more liquid and stir. Administer at least 2 hours before or 2 hours after other medications, as it can affect absorption. Psyllium usually produces a bowel movement within 12 to 72 hours. It may cause bloating and cramping. Side effects: adverse effects. Psyllium is generally well tolerated, however, some individuals may experience abdominal discomfort, ongoing constipation, diarrhea, or obstruction. It may also interfere with medication absorption. Health teaching and health promotion: when teaching clients how to take psyllium at home, in addition to the above considerations, advise them to start with 1 dose per day, but may gradually increase to 3 doses per day, as necessary to maintain soft stools. Stool softeners. Docusate is a common OTC stool softener that is also used frequently in healthcare settings. Mechanism of action: Docusate facilitates movement of water and fats into stool to make it soft and improve regularity of bowel movements. Indications: stool softeners are medications that help to moisten and soften the stool, making it easier to pass. Nursing considerations: Docusate usually produces a bowel movement in 12 to 72 hours. It may cause stomach cramping. Side effects, adverse effects. Stool softeners can cause diarrhea, nausea, vomiting, abdominal cramping, and electrolyte imbalances in some clients. Health teaching and health promotion. Stool softeners may interact with other medications, such as blood thinners or antibiotics. They should not be used in individuals with intestinal blockages. Osmotic agents. Milk of magnesia and polyethylene glycol 3350 are examples of common osmotic agents used to promote a bowel movement. 34. Figure 7.15. Miralax and milk of magnesia. Mechanism of action. Osmotic agents cause water to be retained with the stool, increasing the number of bowel movements and softening the stool so it is easier to pass. Indications. They are often used to treat constipation or to prepare for certain medical procedures, such as colonoscopies. Nursing considerations. Polyethylene glycol 3350 has a bottle top that can be used as a measuring cap to contain 17 grams of powder when filled to the indicated line. Fill to the top of clear section in cap, which is marked to indicate the correct dose. Stir and dissolve in any 4 to 8 ounces of beverage and then administer. Side effects, adverse effects. Side effects of osmotic agents include diarrhea, abdominal cramping, electrolyte imbalance, dehydration, or allergic reactions. Health teaching and health promotion. In addition to the administration considerations above, teach clients that polyethylene glycol usually produces a bowel movement in 1 to 3 days. It may cause loose, watery stools. Lubricants. A mineral oil enema is an example of a lubricant 35 laxative. Figure 7.16 Mineral oil enema. Mechanism of action. Mineral oil coats the stool to help seal in water. Indications. Mineral oil may be used to relieve constipation by lubricating and softening the stool. Nursing considerations. Read drug label for children, as some brands can be used in children aged 2 or older, whereas others are not intended for children. Side effects, adverse effects. Side effects of mineral oil enemas may include irritations and inflammation of anal area, electrolyte imbalances, dehydration, or interference with medication absorption. Health teaching and health promotion. A mineral oil enema generally produces a bowel movement in 2 to 15 minutes. It may cause stomach cramps, bloating, upset stomach, or diarrhea. Stimulants. Bisacodil is an example of a stimulant laxative. Mechanism of action. Bisacodil causes the intestines to contract, inducing the stool to move through the colon. Indications. Stimulant laxatives such as bisacodil are used to treat constipation and prepare the bowel for medical procedures. Nursing considerations. Oral dosage or rectal suppositories are available. See instructions for how to insert a rectal suppository. Instruct the client to retain suppository for about 15 to 20 minutes. Figure 7.17 Administering a rectal suppository. Side effects, adverse effects. Common side effects of bisacodil include abdominal cramps, nausea and vomiting, diarrhea, rectal irritation, dehydration, or electrolyte imbalances. Adverse effects may include severe abdominal pain, rectal bleeding, severe dehydration, fainting, and hypokalemia. Health teaching and health promotion. A bowel movement is generally produced in 15 minutes. Bisacodil may cause stomach cramps, dizziness, or rectal burning. Herbals. Many herbal substances may be useful in facilitating natural bowel function. Substances such as senna can have a significant benefit in relieving constipation due to its laxative properties. Senna is a plant that belongs to the legume family. Mechanism of action. Senna leaves contain compounds known as anthraquinones, which act as stimulant laxatives by increasing motility of the intestines. Indications. Senna is given to increase motility of the intestines and promote bowel movements. Nursing considerations. Overuse of senna can result in diarrhea and dehydration. Clients should take adequate fluids to prevent dehydration. Short-term use is recommended to diminish risk of dependence. Side effects, adverse effects. Senna can cause cramps, bloating, and abdominal discomfort. Overuse can lead to diarrhea and dehydration, as well as an electrolyte imbalance. Health teaching and health promotion. Senna can cause discoloration of the urine, turning it into a reddish-brown color. It is important that clients take Senna at the lowest possible dose for the shortest duration of time. Now let's take a closer look at the medication grids, comparing medications 38 used to treat constipation. Medication grids are intended to assist students to learn key points about each medication. Because information about medication is constantly changing, nurses should always consult evidence-based resources to review current recommendations before administering specific medication. Basic information related to each class of medication is outlined below. Detailed information on a specific medication can be found for free at DailyMed. On the home page, enter the drug name in the search bar to read more about the medication. Prototype, generic medications listed in the grids below are also linked directly to a DailyMed page. Table 7.4D medication grid comparing laxatives used to treat constipation. An interactive H5P element has been excluded from this version of the text. You can view it online here. GI Bowel Disorder Mediations Quiz by E. Kreisman for OpenRN is licensed under CC by 4. A client who underwent hip surgery 2 days ago has not had a bowel movement since before admission. The client is receiving OxyContin ER 10 mg every 12 hours and oxycodone 5 mg every 4 hours for pain. The client describes abdominal discomfort, and the nurse finds decreased bowel sounds in all quadrants. The nurse notifies the provider, follows the bowel protocol, and administers docusate sodium to the client. 1. What are the potential causes of constipation that should be addressed for this client? 2. What is the mechanism of action for docusate? 3. The client asks how quickly the medication will work. What is the nurse's best response? 4. What other preventative measures for constipation should the nurse teach the client? 5. If docusate is not effective within 24 hours, what other medications can the nurse anticipate being ordered? Note: answers to the critical thinking activities can be found in the answer key section at the end of the book. 7.5 Antiemetics. This section will review the pathophysiology of nausea and vomiting and then apply the nursing process to administering antiemetic medications. Review of the pathophysiology of nausea and vomiting. Nausea and vomiting are common conditions. Nausea is the unpleasant sensation of having the urge to vomit, and vomiting is the forceful oral expulsion of gastric contents. There are many potential causes of nausea 1 and vomiting, such as the following: morning sickness during pregnancy, gastroenteritis, and other infections, migraines, motion sickness, food poisoning, GERD and ulcers, intestinal obstruction, poisoning or exposure to a toxic substance, diseases of other organs. Nausea and vomiting are common and are usually not serious. However, the healthcare provider should be contacted immediately if the following conditions occur: vomiting for longer than 24 hours, blood in the vomit, severe abdominal pain, severe headache and stiff neck, signs of dehydration such as dry mouth, infrequent urination, or dark urine. Treatment of nausea and vomiting should be tailored to the cause. There are several medications that work on different neuroreceptors that when used can treat nausea and vomiting. For severe cases of vomiting, intravenous fluids may also be needed to treat the accompanying dehydration. The vomiting center and associated neurotransmitters. The vomiting center can be activated directly by irritants or indirectly following input from 4 principal areas: gastrointestinal tract, cerebral cortex and thalamus, vestibular region, and chemoreceptor trigger zone. See Figure 7.18 for an illustration of the pathophysiology of nausea and for vomiting. 2. Medline Plus. Bethesda, National Library of Medicine. Nausea and vomiting. Nausea and vomiting.html. 3. Bashashati M. and MC-CALM-R, neurochemical mechanisms and pharmacologic strategies in managing nausea and vomiting related to cyclic vomiting syndrome and other gastrointestinal disorders. European Journal of Pharmacology, 772-79. 4. Becker D.E., Nausea, Vomiting, and Hiccups, a Review of Mechanisms and Treatment. Anesthesia Progress, 57, 150-157. Figure 7.1, 8. Pathophysiology of nausea and vomiting. An important part of the emesis circuit is the chemoreceptor trigger zone, located in the area postrema in the brain. The CTZ is not restricted by the blood-brain barrier, which allows it to respond directly to toxins in the bloodstream such as anesthesia and opioids. The CTZ also receives stimuli from several other locations in the body, including the vestibular center, visceral organs such as the GI tract, kidneys and liver, the thalamus, and the cerebral cortex. The vestibular center and cerebral cortex can stimulate the vomiting center directly or indirectly through the CTZ. The vestibular system is located within the inner ear and gives a sense of balance and spatial orientation for the purpose of coordinating movement with balance. The feeling of nausea associated with motion sickness often arises from stimuli from the vestibular center. The gastrointestinal tract sends stimuli to the CTZ via cranial nerves 9 and X related to obstruction, distension, inflammation, and infection. The cerebral cortex and other parts of the brain can also stimulate a sense of nausea related to odors, tastes, and images, and send these stimuli to the CTZ. The CTZ forwards these signals to the vomiting center in the brain. Pain can also directly stimulate the vomiting center. The vomiting center is located in the medulla in the brain. In response to these stimuli, the vomiting center initiates vomiting by inhibiting peristalsis and producing retroperistaltic contractions beginning in the small bowel and ascending into the stomach. It also produces simultaneous contractions in the abdominal muscles and diaphragm that generate high pressures to propel the stomach contents upwards. Additionally, autonomic stimulation of the heart, airways, salivary glands, and skin cause other symptoms associated with vomiting such as salivation, pallor, sweating, and tachycardia. Several neurotransmitters are involved in the nausea and vomiting process, and antiemetic medications are targeted to specific neuroreceptors. Table 7.5a compares the neurotransmitters involved in the nausea and vomiting process, classes of antiemetic medication targeting these neurotransmitters, prototype antiemetic medications, and associated 6 mechanisms of action. Each medication class is also discussed in more detail later in this section. Table 7.5a Neurotransmitters and associated medications used to treat nausea and vomiting. 5. Becker D.E. Nausea, Vomiting, and Hiccups, a Review of Mechanisms and Treatment. Anesthesia Progress, 57, 150-157. 6. Bashashati M. and MC-CALM-R, neurochemical mechanisms and pharmacologic strategies in managing nausea and vomiting related to cyclic vomiting syndrome and other gastrointestinal disorders. European Journal of Pharmacology, 772-79, applying the nursing process to administering antiemetics. Assessment. When administering antiemetics, identify factors contributing to the symptoms of nausea and vomiting so that treatment can correctly target the cause. Document the frequency and amount of emesis and effects on the client's appetite and fluid intake. Assess for symptoms of dehydration, such as decreased blood pressure associated with tachycardia, decreased skin turgor, and decreased urine output or dark concentrated urine. If lab tests are ordered, monitor hemoglobin, hematocrit, and serum sodium levels for additional signs of dehydration. Implementation. Advocate for the most effective route of administration if the client is vomiting. Consider timing of administration of antiemetics in advance of meals when appetite is affected. Follow drug label administration information. and monitor the client closely for potential side effects associated with that category of medication. For example, when administering anticholinergics and antihistamines, monitor for anticholinergic side effects, especially in elderly clients. Evaluation. Monitor for improvement of nausea and vomiting and notify the provider if expected improvement does not occur so that other treatment can be initiated. Continue to monitor for dehydration. Teach the client these non-pharmacological interventions for nausea. Drink enough fluids to avoid dehydration. If you are having trouble keeping liquids down, drink sips of clear liquids every few minutes. Eat bland foods. Stay away from spicy, fatty, or salty foods. Eat smaller meals more often. Avoid strong smells because they can sometimes trigger nausea and vomiting. If you are pregnant and have morning sickness, eat crackers before you get out of bed in the morning. Antiemetic medication classes. Anticholinergics. Scopolamine is an example of an anticholinergic medication that is often used to treat motion sickness or nausea and vomiting associated with surgical recovery from anesthesia and/or opiate analgesia. Mechanism of action. Anticholinergics block ACH receptors in the vestibular center and within the brain to prevent nausea-inducing stimuli to the chemoreceptor trigger zone and the vomiting center. They also dry GI secretions and reduce smooth muscle spasms. Indications. Anticholinergics, like scopolamine, are commonly used to prevent motion sickness and treat nausea and vomiting. Nursing considerations. The scopolamine transdermal patch to an area of intact skin on the head, behind the ear. The system is formulated to deliver approximately 1 milligram of scopolamine to the systemic circulation over 3 days. It is contraindicated in clients with glaucoma. It has been reported to exacerbate psychosis, induce seizures, and cause drowsiness, confusion, and sedation. Due to its anticholinergic properties, scopolamine can decrease gastrointestinal motility and cause urinary retention. Scopolamine should be discontinued in clients who develop difficulty in urination. Scopolamine transdermal patches contain an aluminized membrane. Skin burns have been reported at the application site in clients wearing an aluminized transdermal system during an MRI scan. Remove scopolamine transdermal patches before undergoing an MRI. Figure 7.19 Scopolamine transdermal patch. Application instructions. Only wear one transdermal system at any time. Do not cut the transdermal system. Apply the transdermal system to the skin in the postauricular area. After the transdermal system is applied on the dry skin behind the ear, wash hands thoroughly with soap and water and dry hands. If the transdermal system becomes displaced, discard the transdermal system and apply a new transdermal system on the hairless area behind the other ear. For surgeries other than cesarean section, apply one scopolamine transdermal system the evening before scheduled surgery. Remove the transdermal system 24 hours following surgery. Side effects, adverse effects. Anticholinergics have potential side effects such as dry mouth, constipation, blurred vision, confusion, and memory impairment, especially in elderly clients. Health teaching and health promotion. Scopolamine transdermal patches may impair the mental and/or physical abilities required for the performance of hazardous tasks such as driving a motor vehicle, operating machinery, or participating in underwater sports. Concomitant use of other drugs that cause central nervous system adverse reactions or that have anticholinergic properties may increase this impairment. Inform clients not to operate motor vehicles or other dangerous machinery or participate in underwater sports until they are reasonably certain that scopolamine does not affect them adversely. Scopolamine can cause temporary dilation of the pupils, resulting in blurred vision if it comes in contact with the eyes. Advise clients to wash their hands thoroughly with soap and water and dry their hands immediately after handling the transdermal system. Upon removal, fold the used transdermal system in half with the sticky side together and discard and household trash in a manner that prevents accidental contact or ingestion by 9 children, pets, or others. Antihistamines. Meclizine is an example of an antihistamine that is often used to treat motion sickness. Mechanism of action: antihistamines block H1 receptors in the vestibular center and may also block acetylcholine. Indications: antihistamines such as meclizine block the action of histamine in the body. When H1 receptors are blocked in the vestibular center, this prevents motion sickness and nausea. Nursing considerations: antihistamines are contraindicated in clients with glaucoma or an enlarged prostate gland. Dosage should be started 1 hour before travel begins. Side effects, adverse effects. Antihistamines have potential side effects such as drowsiness, dry mouth, blurred vision, and constipation. Some antihistamines can also interact with other medications or medical conditions. Health teaching and health promotion. Advise clients of the following. Do not exceed recommended dosage. Be advised that drowsiness may occur. Avoid alcohol, sedatives, and tranquilizers, which may increase drowsiness. Avoid alcoholic drinks. Be careful when driving a motor vehicle or operating machinery. Dopamine antagonists. Prochlorperazine is an example of a dopamine antagonist used to treat nausea and vomiting. It can also be used as an antipsychotic medication. Mechanism of action: prochlorperazine blocks dopamine in the chemoreceptor trigger zone. It also calms the central nervous system and may also block acetylcholine. Indications: dopamine antagonists block the action of dopamine in the brain and can help treat nausea and vomiting. Nursing considerations: prochlorperazine can be administered orally, intramuscularly, rectally, or intravenously. It is contraindicated in children under age 2 or under 20 pounds. Severe side effects have occurred when used to treat psychosis. Side effects, adverse effects. Potential side effects are drowsiness, restlessness, dry mouth, constipation, and movement disorders, especially with long-term use. Health teaching and health promotion. Clients should be instructed to take medications as prescribed. They should avoid alcohol and other CNS depressants. Clients may experience increased photosensitivity, and extreme temperatures should be avoided. Clients should be advised that urine May 11th turn pinkish to reddish brown. Prokinetics. Metoclopramide is an example of a prokinetic medication. Figure 7.20 prokinetics. Mechanism of action: metoclopramide blocks dopamine and may also sensitize tissues to acetylcholine. It is used to promote peristalsis to empty the gastrointestinal tract and thus reduce nausea. Indications: metoclopramide is a dopamine antagonist that can be used to treat gastrointestinal disorders by improving motility. Nursing considerations: metoclopramide can be administered orally, intramuscularly, and intravenously. The onset of pharmacological action of metoclopramide is 1 to 3 minutes following an intravenous dose, 10 to 15 minutes following intramuscular administration, and 30 to 60 minutes following an oral dose. Pharmacological effects persist for 1 to 2 hours. Metoclopramide should not be used whenever stimulation of gastrointestinal motility might be dangerous. Metoclopramide is contraindicated in clients with pheochromocytoma because the drug may cause a hypertensive crisis. Metoclopramide should not be used in epileptics or clients receiving other drugs that are likely to cause extrapyramidal reactions because the frequency and severity of seizures or extrapyramidal reactions may be increased. Rare reports of neuromalignant syndrome have occurred. Side effects, adverse effects. Metoclopramide has potential side effects, such as drowsiness, restlessness, movement disorders, and an increased risk of depression and suicidal thoughts, especially with long-term use. Health teaching and health promotion. Teach clients to immediately inform the healthcare provider if they experience new feelings of depression or abnormal muscle movements they cannot control, such as the following: lip smacking, chewing or puckering of the mouth, frowning or scowling, sticking out the tongue, blinking and moving the eyes, shaking of the arms and legs, serotonin antagonists, Ondansetron is an example of a serotonin antagonist often used to treat severe nausea and vomiting associated with chemotherapy, postoperative nausea and vomiting, and hyperemesis during pregnancy. Figure 7.2. 1. Ondansetron blocking the 5-HT3 receptor. Mechanism of action. Ondansetron blocks serotonin receptors in the GI tract, the chemoreceptor trigger zone, and the vomiting center. See 15-16 figures 7.22 and 7.23 for images of the injectable and oral formulations of ondansetron. Figure 7.22 ondansetron in injectable form. Figure 7.23 ondansetron in tablet form. Indications: serotonin antagonists, also known as serotonin blockers, are a class of drugs that block the action of serotonin, a neurotransmitter in the brain. Nursing considerations: ondansetron is available as an orally disintegrating tablet and as an injectable for those clients too nauseated to tolerate oral medication. It is contraindicated with apomorphine. Serotonin syndrome can occur if administered concurrently with other serotonin antagonists or selective serotonin reuptake inhibitors. Ondansetron can cause headaches, drowsiness, constipation, fever, and diarrhea. A rare but serious adverse effect of ondansetron is QT prolongation that can cause an abnormal cardiac rhythm. Side effects, adverse effects. It is important to note that serotonin antagonists have potential side effects such as dizziness, headache, constipation, and nausea. Some serotonin antagonists can also interact with other medications or medical conditions. Health teaching and health promotion. Teach clients to immediately inform their healthcare provider if they experience a change in heart rate, lightheadedness, or feel faint, or have any signs and symptoms of hypersensitivity reactions such as fever, chills, rash, or breathing problems. Neurokinin receptor antagonists. Aprepitant is an example of a neurokinin antagonist used to prevent nausea and vomiting associated with chemotherapy and surgery. Mechanism of action: aprepitant inhibits substance P neurokinin receptors in the brainstem. Indications: neurokinin receptor antagonists are a class of drugs that block the action of substance P, a neuropeptide that plays a role in pain, inflammation, and other physiological processes. Nursing considerations: aprepitant is usually administered concurrently with dexamethasone and ondansetron. It can be administered orally or intravenously. It has clinically significant CYP3A4 drug interactions with medications such as pimozide, diltiazem, and rifampin, and can decrease INR levels when taken concurrently with warfarin. It can also reduce the effectiveness of oral contraceptives. Side effects, adverse effects. Neurokinin receptor antagonists have potential side effects such as fatigue, dizziness, constipation, and decreased appetite. Health teaching and health promotion. Teach clients taking warfarin that they will need to monitor their INR levels more closely, which may require adjustment of the warfarin dosage while taking aprepitant. Teach clients using an oral contraceptive to use backup birth control. Tetrahydrocannabinols, dronabinol, or medical marijuana is an example of a THC medication used to 20% treat nausea in clients with cancer or AIDS. Figure 7.24, dronabinol, a THC medication. Figure 7.25, medical marijuana. Mechanism of action: THC has inhibitory effects in the cerebral cortex, causing an alteration in mood and the body's perception of its surroundings, which may relieve nausea and vomiting, as well as stimulate the appetite. Indications: THC has antiemetic properties and can be used to treat nausea and vomiting associated with chemotherapy or other medical conditions. Nursing considerations: THC will cause dose-related responses such as elation, heightened awareness, and laughing. THC should be used cautiously in elderly clients because they may be more sensitive to the neurological, psychoactive, and postural hypotensive effects of the drug. In general, dose selection for an elderly client should be cautious, usually starting at the low end of the dosing range. Side effects, adverse effects. THC has potential side effects, including impaired memory and concentration, impaired motor coordination, anxiety, and paranoia. Additionally, THC can be habit-forming and may have psychoactive effects that can impair daily activities. Health teaching and health promotion. Teach clients to not drive, operate machinery, or engage in any hazardous activity when using THC. Keep out of reach of children and pets. Herbal and vitamin supplements. Ginger has been used in traditional Indian and Chinese medicine as an antiemetic. Although its mechanism of action is not completely understood, ginger is thought to antagonize the 5-HT and cholinergic receptors and may have direct activity on the gastrointestinal tract. Although ginger can cause reflux and heartburn, and may potentially cause bleeding because of its anticoagulant effects, dosages of up to 2 grams per day in divided doses of 250 milligrams are considered safe even in pregnant women. Pyridoxine has also been recommended for treating nausea and vomiting in pregnancy. Typical dosages of pyridoxine 10 to 25 milligrams every 8 hours cause minimal 22 adverse effects. Now let's take a closer look at the medication grid comparing medications 23 used to treat nausea. See Table 7.5b. Medication grids are intended to assist students to learn key points about each medication. Because information about medication is constantly changing, nurses should always consult evidence-based resources to review current recommendations before administering specific medication. Basic information related to each class of medication is outlined below. Detailed information on a specific medication can be found for free at DailyMed. On the home page, enter the drug name in the search bar to read more about the medication. Prototype generic medications listed in the grids below are also linked to a DailyMed page. Table 7.5b. Antiemetics medication grids. A nurse is caring for a client who underwent surgery earlier today and is experiencing nausea and vomiting. The original post-op orders included prochlorperazine, but the client continues to experience vomiting despite receiving this medication. The nurse calls the provider and receives a new order for ondansetron orally dissolving tablets 8 milligrams 3 times daily as needed. 1. How will the nurse assess for symptoms of dehydration? 2. When administering the medication, the client states, "This tastes terrible. Why can't I have a normal pill to swallow?" What is the nurse's best response? 3. What other measures should the nurse teach the client to reduce feelings of nausea and avoid dehydration? Note: answers to the critical thinking activities can be found in the Answer Key section at the end of the book. 7.6 Learning Activities. Exercises. Case Study 1. Mrs. Jones is a 68-year-old female who has been admitted to the hospital for the management of gastroesophageal reflux disease. She has a history of hypertension and dyslipidemia and is currently taking lisinopril and atorvastatin. Her symptoms include heartburn, chest pain, and difficulty swallowing. Her physician has prescribed omeprazole, a proton pump inhibitor, to manage her GERD symptoms. 1. What are proton pump inhibitors? 2. What is the mechanism of action of PPIs? 3. What are the potential side effects of PPIs? 4. What should the nurse monitor for in Mrs. Jones while she is taking omeprazole? 5. How should the nurse instruct Mrs. Jones to take omeprazole? 6. What are some important drug interactions with omeprazole? 7. When should the nurse instruct Mrs. Jones to follow up with her healthcare provider? Case Study 2. Mr. Lopez is a 45-year-old male who presents to the emergency department with complaints of severe diarrhea for the past 24 hours. He has been experiencing cramping, nausea, and frequent watery stools. He reports no recent travel or dietary changes. Upon further assessment, the healthcare provider diagnoses him with acute infectious diarrhea and prescribes loperamide to manage his symptoms. 1. What is loperamide? 2. What is the mechanism of action of loperamide? What are the potential side effects of loperamide? 3. 4. What should the nurse monitor for in Mr. Lopez while he is taking loperamide? 5. How should the nurse instruct Mr. Lopez to take loperamide? 6. What are some important drug interactions with loperamide? 7. When should the nurse instruct Mr. Lopez to follow up with his healthcare provider? Note: answers to the case studies can be found in the answer key sections at the end of the book. An interactive H5P element has been excluded from this version of the text. You can view it online here. GI flashcards by E. Chrisman for OpenRN is licensed under CC by 4. Test your clinical judgment with this NCLEX Next Generation Style Bowtie question. GI Assignment 1. Test your clinical judgment with this NCLEX Next Generation Style Bowtie question. GI Assessment 2. Savi. Glossary. Adsorption, the adhesion of molecules to a surface. For example, bismuth salicylate coats the walls of the GI tract and binds the causative bacteria or toxin for elimination from the GI tract through the stool. Antacids, used to neutralize stomach acid and reduce the symptoms of heartburn. Antidiarrheals relieve the symptoms of diarrhea, such as an increased frequency and urgency when passing stools, but do not eliminate the cause of it. Antimotility medications, medications that help to treat diarrhea by slowing peristalsis. Area postrema, a structure in the medulla oblongata in the brain stem that controls vomiting. Its location in the brain also allows it to play a vital role in the control of autonomic functions by the central nervous system. Chemoreceptor trigger zone, area in the brain that responds directly to toxins in the bloodstream and also receives stimuli from several other locations in the body that stimulate the vomiting center. Cytochrome P450 enzymes. Enzymes produced from the cytochrome P450 genes involved in the formation and breakdown of various molecules, chemicals, and medications within cells. Defecation, the digestive process where undigested materials are removed from the body as feces. Diarrhea, the passage of 3 or more loose or liquid stools per day. Emesis, the forceful oral expulsion of gastric contents. Gastroenteritis, infection of the intestines. Gastroesophageal reflux disease, caused by excessive hydrochloric acid that tends to back up, or reflux, into the lower esophagus. Hematemesis, blood in the vomit. Hypercalcemia, elevated levels of calcium in the bloodstream. Intrinsic factor necessary for the absorption of vitamin B12 in the small intestine. Osmotic agents cause water to be retained with the stool, increasing the number of bowel movements and softening the stool so it is easier to pass. Parietal cells, cells in the gastric glands that produce and secrete hydrochloric acid and intrinsic factor. Pepsin, a digestive enzyme. Peptic ulcer disease occurs when gastric or duodenal ulcers are caused by the breakdown of GI mucosa by pepsin in combination with the caustic effects of hydrochloric acid. Probiotics, used for the prevention and treatment of diarrhea by restoring normal bacteria flora in the gastrointestinal tract. Prokinetic, medications used to promote peristalsis, to empty the gastrointestinal tract and reduce nausea. Proton pump inhibitors bind to the hydrogen-potassium ATPase enzyme system of the parietal cell and inhibit the release of hydrogen ions into the stomach. Rebound hyperacidity, a side effect of medication causing elevated levels of hydrochloric acid in the stomach after the medication is discontinued. Serotonin syndrome, symptoms associated with serotonin syndrome may include the following: mental status changes, autonomic instability, neuromuscular symptoms and seizures, with or without gastrointestinal symptoms, stimulants, laxatives that cause the intestines to contract, inducing stool to move through the colon, stool softeners, laxatives that facilitate movement of water and fats into stool to make it soft and improve regularity of bowel movements. Stress-related mucosal damage, a common condition in hospitalized clients that can lead to peptic ulcer disease. Stress ulcer prophylaxis, medication to prevent the formation of stress ulcers. Surface epithelium cells, cells found within the lining of the stomach that secrete mucus as a protective coating. THC, tetrahydrocannabinols found in marijuana. Vestibular system, an area located within the inner ear that gives a sense of balance and spatial orientation for the purpose of coordinating movement with balance. Vomiting center, an area in the brain that initiates vomiting by inhibiting peristalsis and producing retroperistaltic contractions beginning in the small bowel and ascending into the stomach. It also produces simultaneous contractions in the abdominal muscles and diaphragm that generate high pressures to propel the stomach contents upwards. 7. Chapter 7. Answer key to Chapter 7. You can review additional information regarding these answers in the corresponding section in which the critical thinking activities appear. Critical thinking activities section 7.3. Postoperative clients often require a proton pump inhibitor due to the stress response that occurs during surgery and hospitalization. Pantoprazole suppresses the secretion of hydrochloric acid and prevents the formation of a stress ulcer. Critical thinking activity, section 7.4a. 1. The client may be experiencing increased heart rate as a symptom of dehydration associated with water loss from the diarrhea. Additionally, a boxed warning for loperamide is abnormal heart rhythm. The nurse should assess the client's heart rate and rhythm and notify the provider. 2. The nurse can recommend providing over-the-counter probiotics, which are also found in yogurt, for the prevention of diarrhea associated with antibiotic use or to assist in decreasing the symptoms of diarrhea. Critical thinking activities section 7.4 billions. 1. A postoperative client has many risk factors for constipation, including side effects of anesthesia and opiates, sedentary levels of activity, and decreased fluid and food intake after surgery. In addition to administering Docusate or other laxatives as needed, the nurse should educate the client about non-pharmacological interventions to relieve constipation, such as increasing fluid and fiber intake and walking. 2. Docusate softens the stool and improves the regularity of bowel movements. 3. Docusate usually works within 12 to 72 hours. If it is not effective in creating a bowel movement with soft stool, the client should be instructed to notify the nurse and additional laxatives can be administered. 4. Preventative measures for constipation include increasing fluid and fiber intake, ambulating, and using the least amount of opiates needed to effectively treat the pain. 5. Bowel protocols usually include a stepwise approach to constipation. Docusate or polyethylene glycol 3000E350 is often used preventively, but if a bowel movement does not occur within the expected time frame, additional laxatives such as bisacodyl or an enema may be added. A bisacodyl suppository generally produces a bowel movement within 1 hour, whereas a mineral oil enema usually works within 15 minutes of administration. Critical thinking activity section 7.5. 1. The nurse assesses for dehydration by monitoring blood pressure for hypotension, heart rate for tachycardia, urine output for decreased level, skin for tenting, and mucous membranes for dryness. 2. The dissolving tablets eliminate the risk of vomiting the medication before it is absorbed. If the client can't tolerate the dissolving tablets, the nurse can request the provider to change the route of ondansetron to the intravenous route. 3. The nurse should plan to proactively administer medications before meals to prevent nausea. The client can also be instructed to follow a bland diet to prevent feelings of nausea that can be stimulated by spicy food or strong flavors. Fluids should be encouraged to prevent dehydration. But if fluids increase the client's feelings of nausea, the client can be instructed to take frequent sips of fluid or suck on ice chips. 1. Proton pump inhibitors are a class of drugs that reduce the production of stomach acid. They work by blocking the proton pump in the parietal cells of the stomach that produces acid. Examples of PPIs include omeprazole, esomeprazole, lansoprazole, pantoprazole, and rabeprazole. 2. PPIs work by irreversibly binding to the proton pump, which is responsible for the final step in acid production in the stomach. By blocking the proton pump, PPIs reduce the production of stomach acid. 3. The most common side effects of PPIs include headache, diarrhea, abdominal pain, and nausea. Long-term use of PPIs has been associated with an increased risk of osteoporosis-related fractures, kidney disease, and infections such as pneumonia and Clostridioides difficile infection. 4. The nurse should monitor Mrs. Jones for relief of her GERD symptoms, as well as any adverse effects of omeprazole, such as headache, diarrhea, abdominal pain, and nausea. The nurse should also monitor Mrs. Jones's electrolyte levels, particularly magnesium and potassium, as long-term use of PPIs can lead to electrolyte imbalances. Additionally, the nurse should monitor Mrs. Jones for signs and symptoms of C. difficile infection, such as diarrhea and abdominal pain. 5. The nurse should instruct Mrs. Jones to take omeprazole once a day, preferably in the morning before breakfast. Omeprazole should be taken at the same time each day to maintain a consistent blood level. The nurse should also instruct Mrs. Jones not to crush, chew, or break the capsules, but to swallow them whole. If Mrs. Jones has difficulty swallowing the capsule, the nurse may suggest opening the capsule and mixing the contents with applesauce or water. 6. Omeprazole can interact with other drugs that are metabolized by the liver, such as warfarin, diazepam, and phenytoin. Omeprazole can increase the effects of these drugs, leading to a higher risk of bleeding or sedation. Additionally, omeprazole can decrease the absorption of certain drugs, such as ketoconazole and atazanavir, so it is important to separate the administration of these drugs from omeprazole by several hours. 7. The nurse should instruct Mrs. Jones to follow up with her healthcare provider if her GERD symptoms do not improve or if she experiences any adverse effects of omeprazole. The nurse should also instruct Mrs. Jones to follow up with her healthcare provider if she experiences any signs or symptoms of C. difficile infection, such as diarrhea and abdominal pain. Section 7.6 Case Study 2. 1. Loperamide is an anti-diarrheal medication that works by slowing down the movement of the intestines and reducing the frequency of bowel movements. 2. Loperamide works by binding to opioid receptors in the gut, which decreases the activity of the intestinal muscles and reduces the speed at which food moves through the digestive tract. This results in decreased diarrhea and increased water absorption. 3. The most common side effects of loperamide include constipation, abdominal cramping, and bloating. In rare cases, loperamide can cause severe constipation, which can lead to intestinal obstruction. 4. The nurse should monitor Mr. Lopez's bowel movements and symptoms of dehydration, such as thirst, dry mouth, and decreased urine output. The nurse should also monitor Mr. Lopez's electrolyte levels, particularly potassium, as loperamide can cause electrolyte imbalances. Additionally, the nurse should monitor Mr. Lopez's pain level and bowel sounds, as severe constipation can lead to abdominal pain and distension. 5. The nurse should instruct Mr. Lopez to take loperamide as directed by his healthcare provider. Typically, the initial dose is 2 capsules followed by 1 capsule after each loose stool, up to a maximum of 8 capsules per day. The nurse should also instruct Mr. Lopez to drink plenty of fluids to prevent dehydration and to avoid alcohol and caffeine, as they can worsen diarrhea. 6. Loperamide can interact with other drugs that slow down the movement of the intestines, such as opioids and anticholinergics. Loperamide can increase the effects of these drugs, leading to constipation and other adverse effects. Additionally, loperamide can decrease the absorption of certain drugs, such as digoxin and quinidine, so it is important to separate the administration of these drugs from loperamide by several hours. 7. The nurse should instruct Mr. Lopez to follow up with his healthcare provider if his diarrhea persists for more than 2 days, if he experiences severe constipation or abdominal pain, or if he develops a fever or bloody stools. The nurse should also instruct Mr. Lopez to follow up with his healthcare provider if he experiences any adverse effects of loperamide, such as severe constipation or bloating,